The way the treatment works, Sally, is that it's very effective if taken within the first 48 or 72 hours, because this is a viral infection. These are viral infections that require an antiviral medication. So what we call acyclovir, which is the active ingredient, is available in pharmacies under different names like Zovirax and acyclovir by its name. When we start this medication in the first 48 hours or the first 72 hours, the patient's response is excellent, very, very, very excellent, and the chance of complications is very, very, very low.
Welcome to a new episode of our podcast. And of course, with us today is Dr. Basyouny. We welcome him, a specialist in family medicine and geriatrics. Welcome, doctor.
Thank you for having me, Sally, and welcome to our viewers and listeners.
Welcome. Today we're going to talk about an important topic that many people experience, and we want to know more details about it. Shingles. Okay, let's start with the term shingles. Why is it called that?
That's an excellent question. Look, the common name for shingles, how did it come about? It's because the patient feels a burning sensation on their skin, and because its infection takes the place of the nerve or the course of the nerve. So if we assume, for example, that the nerves that supply this area are all drawn in the shape of a semi-arch or a semicircle, one under the other, it takes the path of the nerve. So if we assume that it took that path of the nerve, they call it a belt, the nerve's belt, which is the course or the path of the nerve.
The nerve's path.
So the patient feels like they have a belt that is burning their skin, or they have something moving along a line of a specific nerve and they feel a terrible fire. That's why they called it the fiery belt. But in reality, Sally, it's a viral infection, meaning it's a virus that causes these symptoms, and the onset of its symptoms is a burning sensation.
So the burning sensation is the symptom that appears.
Exactly, even before anything appears on the skin.
What's the difference between it and the chickenpox that children used to get?
That's an excellent question, Sally. The virus that causes chickenpox is the same virus that causes shingles many years later. It's a virus called varicella. Most of the time it infects children. Of course, some people get it as adults because they didn't get it as children, but most of the time the infection occurs in children at a young age. When this virus infects children, it causes chickenpox. And what is that? Chickenpox is a fever with symptoms similar to a cold, along with the appearance of a skin rash that looks like watery blisters on the body. It initially appears on the chest, abdomen, and back, and then spreads to the rest of the body, including the head. So that's for chickenpox. The virus is called varicella. The child gets chickenpox, goes through the period of symptoms, and then recovers. This virus remains and hides in the body's nerve ganglia. Then, at some point in that child's life, when they become an adult, it reactivates for some reason and causes another infection called shingles. So it's the same virus but with different symptoms. One happened at one time and the other at another. But this is a point that lets us confirm to people that no one gets shingles from the start. Shingles means that they had chickenpox in the past.
So anyone who got chickenpox, the virus didn't go away. It remained dormant in the body for a period, and it's up to fate when it will appear or not. Okay, so what is the reason that makes it become active after all these years of being dormant?
Good, that's a very good question. There is no clear medical evidence to this day based on medical research that says a specific reason is what activates it. However, there are theories. The companies conducting research on patients who got it try to establish a link between the trigger that reactivated it. They propose theories or concepts. Most of these concepts suggest that most likely the person's immunity is not what it used to be, and they provide evidence and support for the fact that most patients who get herpes zoster or shingles at an older age are diabetic patients, and a portion of the patients are taking medications that suppress the immune system, like people who have autoimmune diseases, for example, or people who take medications containing cortisone for a long time. Of course, it can happen to people who don't have diabetes, don't take immune suppressing drugs, and don't take cortisone. But the majority of cases usually have an issue with their immunity. So this is the theory or the medical concept of the matter.
Yes, so there's nothing certain yet to say what caused it. It's something that so far just happens. It doesn't have a cause that's linked to anything specific yet.
The prevailing medical concept is a weakened immune system.
A weakened immune system is the common factor in all cases, exactly. So, does this mean we can say that there are no individuals more susceptible to it than others? I mean, by this measure, we've concluded that there aren't people I can say are more at risk than others. Is that right?
Yes, we can't make that distinction at all. But we say that whoever had chickenpox has a high probability of getting shingles when they're older. Someone who never had chickenpox will not get shingles.
Because if they get it, it's ruled out. Exactly.
Yes.
Okay. Okay, what are the symptoms that if a person gets them, they should start suspecting it's shingles and act accordingly?
Okay. By the way, regarding the symptoms, so people can also focus, because everyone imagines that the symptoms are the skin rash that looks like blisters filled with fluid or something like water. But the symptoms don't always start like that. The symptoms begin with a sensation of burning or tingling somewhere in the body. Most of the time, it's on one half, either the right or the left half. For example, a patient gets it on their back or chest. It follows the course or path of the nerve, so it's not spread, for instance, all over the chest or the entire abdomen or the whole back. It's not like chickenpox in that regard. It only takes a belt-like shape or a specific nerve path. It can appear anywhere on the body, and the symptoms last for 1 to 2 days, just a sensation of burning and fire. After about 2 days, a skin rash starts to appear, which consists of sacs containing fluid, similar to those of chickenpox. But they are next to each other, or like herpes. Everyone knows what herpes looks like. It's like herpes, because it's one of its types. So it's filled with fluid and follows a certain path. But the difference between it and chickenpox is that this is only in this one place. For example, yes, if the patient gets it in this area, not all over the body. Okay, the burning sensation is very, very distinct for the patient, and this is what bothers the patient the most. I mean, the patient isn't too upset or bothered by the idea of the watery blisters, but the burning and fire-like sensation is the worst thing the patient complains about. So these are its symptoms. It's quite rare. I mean, some people get a fever with it, but in many cases, it doesn't come with a fever. Okay, all right.
So when a person like this comes to you, doctor, how do you diagnose the case? I mean, to say for sure that this is it.
Its diagnosis is what we call a clinical diagnosis. This means we don't need to order a test to confirm that it's the herpes zoster type or this virus. Of course, if someone wanted to be sure, we could take a sample and analyze it in the lab. However, its diagnosis is a clinical one, which we make in the clinic. We don't need to ask the patient for tests or make them spend money. We start the treatment as soon as we diagnose. And of course, we hope that people, whoever feels something like this, seeks medical attention immediately and doesn't wait. Because when the treatment starts, makes a huge difference when it comes to shingles.
Okay. So let's talk about the complications. What are the most dangerous complications that can happen?
Regarding complications, most people don't experience them. However, some people, especially those who started treatment late or who didn't take any antivirals at all, get something called postherpetic neuralgia. The skin rash they had or the water-filled blisters may have disappeared. They lasted for their duration, formed crusts, and the crusts went away. The patient feels a slight improvement for a short period, and then it begins. The same symptoms of burning and fire for the patient, and they are severe, even more severe than before at times. It can last for weeks, it can last for months, it can last for years, it can last a lifetime. It's as if the patient has a place where they feel that burning sensation all the time. So that's the big problem. The second problem is if it appears in a sensitive area like the face. Sometimes, and thankfully it doesn't happen to most people, it appears on the face. When it appears on the face, it harms the area where it is located. So if it's near the eye, it can harm the eye. If it's near the ear, it can harm the ear and cause complications. Thankfully, most people don't get it on the face, but there are recorded cases on the face, and we see them every year. Again, I stress to people to visit a doctor as soon as possible.
Okay, you said the timing of the treatment makes a difference. If we feel something, we should go to the doctor right away so we don't experience that major complication you mentioned, right?
Yes, that's exactly right. The timing of the treatment, Sally, is that it works with great effectiveness if it's taken within the first 48 or 72 hours, because this is a viral infection, and all viral infections require an antiviral medication. So what we call acyclovir, which is the active ingredient, is available in pharmacies under different names like Zovirax and acyclovir by its generic name. When we start this medication within the first 48 hours or the first 72 hours, the patient's response is excellent, really, really excellent, and the chance of the complications we mentioned becomes very, very, very low. So that's the idea behind starting the treatment early. Now, if the patient comes to us after 72 hours, can we give them antivirals? Yes, the answer is we can. However, we don't have much hope, or we don't have a strong guarantee that they won't develop complications. But we still give them antivirals. It has a specific dose, so people shouldn't take it on their own. It has a specific dose that is higher than all the antiviral doses we give for herpes in any other location. Meaning for any different type of herpes, the antiviral dose is lower than the dose we give to a shingles patient, whether it's a child or an adult. So that's regarding the duration of treatment or the period when we start the treatment. Of course, the patient sometimes feels some pain or, the skin is bothering them, so we also give them medications to calm the sensation of burning or fire, in addition to the antivirals. Okay, regarding the treatment, I want to stress again, Sally, that just because 3 days have passed, it doesn't mean the patient should stay home and say, that's it, I've had it for 3 days, so if I go now, I won't be able to get treatment. No, we don't lose hope. We go to the clinic, we get the treatment, and we listen to the doctor's advice so that they can give you some tips on what to do with your close contacts or how to manage the rash. Okay?
Okay, is there a vaccine for it?
There is a vaccine, and the vaccine is available in all Arab countries and all foreign countries, and we recommend it for all elderly people. Of course, young people can take it if they are at risk, because they might be taking medications that suppress the immune system, or they have autoimmune diseases that require long-term treatment, or they have chronic diseases that can affect their immunity. But perhaps the main target for us is the elderly. They are the most important group that needs to get the shingles vaccine. the vaccine is available. All people who are at high risk of a weakened immune system or have long-term chronic diseases or take chronic medications for many years, they are the target group. Can healthy elderly people get it? Absolutely, yes, because it benefits everyone.
So is this vaccine a one-time thing, or is it like the flu shot that you get periodically?
It's 2 doses. The first dose, let's assume, is taken today. The second dose is given 2 to 6 months later. In some exceptional cases, we can give the second dose earlier, and it would be 1 month after the first dose. But if there are no exceptional circumstances, we give 1 dose, and the second dose is given 2 to 6 months later. So what would be the exception? I mean, what would make us give the dose earlier? Excellent question. The same conditions we mentioned for people who have issues or a weak immune system. For example, someone who started taking medications containing cortisone and knows they will be on it for a long time, and they already have a medical history indicating their immune system isn't really okay, and they get sick a lot and get many infections, so we worry about them. We tell them, no, we won't wait the 2 months, we'll give the second dose after 1 month, because they know they will be on a long-term plan with medications that suppress their immune system. Or they got a disease, God forbid, that damaged the immune system, or is damaging the immune system, or affects the immune system. So whether they're taking a treatment that suppresses the immune system, or their disease is what damaged the immune system, we expedite and give the second dose a bit sooner.
Oh, so their condition requires it as a precaution for them. Exactly. Okay, all right. I have another question, doctor. Is this disease contagious? And if it is, what should the patient do? For how long should they avoid people? I mean, when can they go back to work? After how long? How should they interact with the people they live with?
Excellent. The disease is contagious. This is a viral infection, and all viral infections are contagious. But the one who hasn't had chickenpox before is the one who will get the infection. Because as we said, this is the same virus that started as chickenpox and now has caused shingles. So the patient is contagious, yes, the infection is present, and the infection is mostly transmitted by contact. This means touching the area where the patient's rash was, or touching the patient's clothes that were on their rash, or the patient themselves touched their rash and the blisters filled with fluid, and then shook someone's hand with that same hand. This creates an opportunity for infection. So dealing with the patient's rash or the contact is number one. There are very few cases, Sally, that have been recorded, which we call an aerosolized virus, where the virus, for example, the patient had a skin rash here and kept doing this and scratching it. So a large amount of the virus was released into the air, and a fan was on, which moved the virus, and another patient was infected with this virus. This is not a common way of infection, but it has been recorded in some cases, the aerosolized mode of transmission or this method of infection, but it is rare. Most people get it by contact. The disease is contagious. If someone I've been in contact with gets it, they will get chickenpox if they haven't had it before. If they've had chickenpox before, then that's it. They already have the same virus that I have, which is called herpes, so they're immune, the varicella, meaning they have the same virus, the varicella. Okay, so should they go to work or stay at home? No, of course, they should isolate themselves and stay at home, because it's possible that at their job, they come into contact with people, whether it's clients coming to the office or colleagues at work, and it's possible that one of them has never had chickenpox before. For how long, doctor? They should stay home until the rash forms scabs and the scabs fall off, because some people, as soon as the scabs start to form, they say, that's it, I'm not contagious anymore, that's it. Yes. No, we tell them again that all the scabs must form and all of them must dry up. All of them. There shouldn't be a single blister left with fluid in it. When all the scabs have formed, dried up, and fallen off, that's it. Then we can be sure. Of course, the part about sick leave, it's more of an administrative procedure. Doctors in clinics, if they have a patient with shingles, can provide a medical diagnosis with the duration of the sick leave so that no one faces any administrative problems at work. But of course,
How long does the infection last approximately? I mean, how long does it take for the scabs to disappear completely?
for most people, it's 2 weeks to a month. For most people, it's 2 weeks to a month. Some people might take a little longer, but for most people, it's 2 weeks to a month.
Oh, so that's considered a long time. Now, doctor, there's supposed to be a topical ointment that's applied as an antiviral for the skin rash, and that's considered part of the treatment. So, is it okay for the patient to just use that, or would that be a mistake in the treatment protocol for this disease?
Look, Sally, the antiviral cream called acyclovir, or by any other brand name, is not something we rely on as a treatment for shingles. The patient usually doesn't respond to it most of the time. We give antiviral pills. The patient is bothered by the itching, so they want to apply ice or a cream to soothe the sensation. It's like a fire. They want to scratch it. It's a burning fire. So I reassure people, we give pills that soothe the burning sensation. We give pills that reduce the patient's urge to touch the rash so they don't keep scratching it. We don't really rely on topical creams unless during the clinical examination the doctor finds that signs of bacterial inflammation have started to appear on the rash. In that case, sometimes we prescribe a bacterial antibiotic even though it's a viral infection, but that's when we feel the rash is starting to show signs of bacterial inflammation. Now, as for the topical antiviral, it's not wrong, but it's not effective in most cases. So if a patient uses it, it's not enough on its own. The pills are necessary. So will it harm them if they use it? No, it won't harm them at all, but we don't get,
It doesn't harm.
yes, we don't get good results from it. So it won't cause any harm, but we don't get good results from it. That's regarding the topical treatment.
Okay, to wrap up the episode, doctor, let's ask a very important question. What is your advice for a shingles patient on how to deal with the rash in particular?
Great question. First of all, I wish a speedy recovery to anyone who has or has had shingles. Let's agree that the problem with shingles is the burning sensation and the urge you get to scratch. But also, as we've said, you make it easy to infect others when your hand touches the rash and then you touch anything around you, like the TV remote, the AC remote, your cup, anything at home or at work. This way, you make it easier to infect those around you. So we tell everyone, anyone who gets shingles should cover the area with the rash. Don't leave it exposed. Because people leave it exposed, they can't stand close touching it. We understand that very well. However, to protect those around you, cover the area with the rash. And your clothes that you are wearing or the item you use to cover the rash, you should be the one to handle them. You're the one who will wash it, and you're the one who will handle everything that touches this area. So you treat your hand as a source of infection, and if your hand touches that area, it must be washed very, very thoroughly with soap and water. And let's remind people about washing. For 40 to 60 seconds, I'm constantly rubbing my hands with soap and cleaning my nails, just like we learned during the COVID days. So we count for 40 to 60 seconds while I'm washing my entire hands, my fingers, and my thumbs. It's not just a quick 20-second wash with soap and water and you're done, not at all. To reduce the chance of transmitting the infection, so cover the rash, try not to touch the rash as much as possible, and if you do touch it, wash your hands well. Seek medical attention, or any doctor near you, a family doctor, an internist, a dermatologist. All of them can handle this type of condition and all of them can diagnose it. Follow the advice that the doctor gives you. Don't delay your visit to the doctor no matter how busy you are, because when we start antivirals late, you might develop complications. So in general, this is what we want to tell people. Of course, I thank you for having me today. It's a great, interesting, and important topic. Thank you so much. I'm the one who should be thanking you. Thank you so much for your kindness.
Thank you, doctor.